axillary artery. Okay, axillary artery. So for the axillary artery, first of all, what we do is we always try to identify what the artery on the picture right here on the video, so that when you're watching it, you have a pictorial vision of it, and is usually very much more interactive. So you should know that the axillary artery has 3 parts. Okay, has 3 parts, which we'll get to look at them. Okay, so what we have is the axillary artery, just so you know, is a continuation of subclavian artery. So you could see that on this picture, first of all, you have the subclavian artery, then I think under the clavicle it becomes the axillary artery. So arteries, not that it's different, it's still the same artery, but as it passes different parts in the body, the name changes. Yes. Okay, so it begins at the lateral border of the upper rib, runs through the axillary armpit, and ends at the lower border of the teres major muscle. Okay, so at the lower border of the teres major muscle, it becomes brachial artery. Same artery but different name, simply because it's passing different regions. So origin is a continuation of subclavian artery, begins at the lateral border of the first rib. Okay, so what's the cause? It travels to the axilla, that's the armpit, then it lies in close relation to the brachial plexus cord and the axillary vein. So it ends at the lower border of the teres major muscle. At this place, it becomes the brachial artery. Okay, beautiful. So it has 3 parts, just like I was telling you guys. So the first part is actually before pectoralis minor, while the second part is under pectoralis minor. The third part is after pectoralis minor. Okay, so first part gives rise to the superior thoracic artery. The second part, the Thoracoacromial artery and the lateral thoracic artery. Third part gives rise to the subscapular artery, the anterior circumflex humeral artery, and the posterior circumflex humeral artery. Okay, so supplies the axilla, the shoulder region, lateral thoracic wall. Okay, then the upper limb too. So learn about this artery because it can be involved in traumas, all those fractures of the humerus. Then it's important in orthopedic surgeries and also vascular surgeries. Okay, then we'll learn about it because it has a lot of branches, and the branches are basically what gives up the collateral supply. All of that.